it is of greater weight when an organization representing thousands of physicians does something of this nature, which truly is unprecedented.
Yeah, unprecedented. We told you yesterday the Idaho Medical Association asked the State Board of Medicine to investigate Dr. Ryan Cole. You likely know his name by now. He's a pathologist in Boise and was recently voted onto the Central District Health Board. Dr. Cole has made controversial comments about COVID-19 vaccines, and he claims he prescribes ivermectin to patients all over the country. Ivermectin isn't approved or proven to treat the COVID-19 virus, and in fact, it can be harmful. We talked to the CEO of the Idaho Medical Association today about what exactly prompted them to file this complaint now. They did it last week. While Susie Keller says Cole's comments are unsupported and dangerous, that's not the basis of their complaint.
It came down to more of a question of patient safety, and if he is indeed doing the things he has claimed to have been doing, that violates the Idaho standard of care, the way we want patients to be treated safely. And so we felt that rises to the level of needing to be at least investigated by the Idaho Board of Medicine. What we are asking them to investigate is very narrowly the treatment aspect. Has he been treating patients? One thing to remember is Dr. Cole is a pathologist. He predominantly works in a lab. In fact, if you call his lab, they will say Dr. Cole is not a primary care provider and he is unable to write prescriptions. And it's hard to reconcile that with his previous statements that say, I've written hundreds of prescriptions for this treatment, which is not appropriate for COVID-19 patients.
The IMA and its members worry Cole's claims threaten public health as a whole. This complaint is on the board's agenda later this month. At that point, members will decide if they want to investigate. To be clear, he's not under investigation yet or at this time, or they can decide whether to dismiss the complaint. Dr. Cole responded to us via email last night. He called the complaint unprofessional and said it sows distrust in the medical community and among patients in Idaho. He defended his comments and treatment, saying, quote, medicine advances when we examine what is and is not working, when we notice patterns, and when we continually strive to improve and find answers to perplexing challenges. He goes on to say we can do better as a profession than to silence those who have a different perspective. And you know, Kim, Keller says these documents through the Idaho Medical Board are not really public. They didn't intend on making these documents public, but the Idaho Freedom Foundation got their hands on it and posted it.
Okay, so Idaho Medical Association says, Idaho Medical Board, we want you to investigate Dr. Cole.
Right.
Who is on this medical board? Is it nonpartisan? Who's ultimately going to decide what happens to Dr. Cole?
Yeah, I mean, that's a good question. So the board members, as far as I know and what I researched, is the board members are appointed by the governor. They're public members of the board as well as physician members of the board. They essentially, their job, we never talk about the Idaho Board of Medicine is what it is.
Excuse me, yes.
Yeah, no, I said it wrong too, but we never really talk about it. But you know, it's a really important board in that it oversees regulation and licensing of all physicians. They talk about respiratory therapists, surgeons, a lot of healthcare providers and professionals across the state of Idaho. So of course, we'll stay on top of this story for you and kind of decide, or when they decide what to do with this complaint, we'll of course keep people posted.
And it's up to them then to decide what's next.
Yeah,
All
that's
right.
right.